Hi, my name is Jennifer Simpson, and welcome to another episode of Here's the Deal, virtual edition. We are really lucky today that we have someone with us who's new to the HDSA family, but not to the HD community. The wonderful Allison Bartlett is with us. You might know her from her work with the Caring Voice Coalition. She's been doing disability work and helping folks with HD with their disability claims for several years, and now she is HDSA's manager at disability program. So welcome, Allison.
Jennifer, it's a pleasure to be here and on the HDSA team.
Well, we are thrilled to have you. So disability is one of those interesting things that, folks, I think, only ever really think about disability when they need it. But from our conversations and from what I've learned about the disability program, it's actually something that might take a lot more forethought than we're giving it, than we might be giving it right now. But I was wondering if you could take me back a little bit. Tell me about what is the history of of the disability program? And when I say disability, I mean Social Security disability insurance. So tell me a little bit about the history.
Well, so as everyone should have learned at some point in high school, Social Security started back in the 1930s as a program from FDR during the New Deal and as an economic booster. And that was retirement and things like that. Disability was not added onto Social Security until 1956. So it was something that took a while. And the point of disability was so that people who could no longer work of working ages would still be able to receive income. Interestingly enough, back in 1956, it was only for people between the ages of 50 and 65. In the last 60 years, the program has expanded a lot. Now you can get it as young between the ages of 18 and 65, and it's expanded to a lot more diseases, and it's a lot more encompassing than it used to be. And it's still designed to help those who are no longer able to work because of a disabling condition.
Okay, so it's really a safety net program, right? It's sort of there to catch folks who are at a point where they can earn income for themselves, where that might not be an option for them anymore. And the government sort of provided this program to say, hey, we don't want to allow those who are vulnerable to fall into a cycle of poverty or homelessness. Let's create this disability program to give you a little bit of something to fall back on.
Yeah, and safety net's the perfect way to describe it. It technically can still work, Social Security disability insurance, and apply for it. And the way the government defines that is that you can't actually make to financially support yourself. And so that's defined by minimum wage. So every year there's something called substantial gainful activity, and that changes every year, and it's based on inflation, but it's essentially if you're getting paid wage and you work 40 hours a week. Yeah, I know it's debatable whether people can actually live off minimum wage or not anymore. That's how they define it. So in 2020, substantial gainful activity is $1,260 per month, and that's gross, so before taxes. If you're making less than that and you have a disabling condition of any kind, that means you are eligible to apply for Social Security disability, so you can get additional assistance and continue working.
Okay, so this is interesting to know for folks with HD. So for example, if I were an engineer, which I'm not, but if I were an engineer and I was starting to experience some symptoms of HD that made it hard for me to do my job and made it difficult for me to continue to be an engineer, but I could theoretically still be employed somewhere at around minimum wage level. Let's say if I could be, I could work at my local bookshop, or I could work at the grocery store, I could do something like that. Then theoretically, I wouldn't quite be ready for disability yet.
Yeah, and that is a really important distinction to note, because a lot of people, especially if they have high-level jobs, like if you're an engineer or a lawyer or a doctor, or you're like a CEO or work high up in a company, you think, because the standard is that you can't do any other work in the regional or national economy. So if you have a high-level job, then that means it's going to be really hard to show that you can't work at all. And that's not the case, because having a high-level job takes very different skills than being a cashier or just putting books back in a bookstore. So like if you're a high-level engineer, you have to be able to do these very high-level math problems. You have a very specific workflow that you have to follow. You likely have to multitask. You likely have to follow complex instructions, and you have deadlines, and you have to do all these things. If you're a cashier, hopefully don't have to do all those things. I'd be really concerned if you were in charge of all those things. But for the most part, if you're a cashier at like your local bookstore, your job tasks are going to be a lot simpler. And so it looks a lot different for you to work at that job during the day than the same amount of time you would spend as an engineer. And that's important. And that's why it's important to mention all symptoms and limitations when you file a disability claim, because something that may seem minor may actually have huge positive repercussions for your case and show that you're actually disabled.
Can you think of like a particular example? Not, if I were, if I had a loved one with HD who was struggling to maintain employment, or they've just been let go from their job because of HD related issues, what would be something that I might not necessarily think, oh, I should talk about this on a disability application?
So Social Security has key things they look for. They don't publicly write them anywhere. I have learned these from attending all of the hearings because there's always a vocational expert and it's based on their years of experience and what they tell the judge. But some triggers that will find you disabled is if you're off task more than 10% of the time. Well, so one way to think about that is, do you watch TV shows and movies? Like, do you watch them the same way you used to? Did you used to love to go to see movies, but you can't watch them anymore? Not only can you not watch movies, you have trouble following along during a 30-minute TV show. If you have trouble following along, watching and understanding and paying attention for an entire 30-minute TV show, that seems minor on your application, but that has huge implications for your ability to work and what that means in your disability application. Other things to think about that might not seem like they're a big deal, but have bigger consequences. Like, let's say you don't have a lot of physical symptoms yet. You might have some slight chorea in your legs, but it means that you trip and fall, or you trip and stumble at least on a daily basis. The more you trip and stumble, the more likely it is that you'll be a fall risk. So, and if you're a fall risk, that eliminates a lot of jobs. So Social Security categorizes jobs from like most difficult intellectually to like least difficult. And so a lot of the jobs that you're doing that are not as intellectually difficult require a lot more physical work. Well, let's say you have trouble watching a 30-minute TV show and you also trip and stumble on a daily basis. That's eliminated most of the jobs in the regional or national economy. And those don't like, neither of those seem like huge limitations, but they can have significant consequences.
Yeah, those are such excellent points. I definitely wouldn't have thought of something like I struggle to watch TV shows anymore as a way to demonstrate that I'm having either issues with sort of cognitive tasks, or paying attention, or maintaining sort of my ability to work. I would never have thought of that. That's a really great point. Are there, other than sort of the ability to do gainful work, are there other things that make someone eligible for Social Security disability?
So when you say so, like, are we still talking about SSDI?
Yes, sorry. Yes, SSDI. I know there are so many different sort of terms that, especially within the Social Security world, SSI, SSDI, straight Social Security. So yes, Social Security disability insurance is what I'm talking about.
Well, and I have to ask, because there are two big distinctions. So the only real way you can be eligible for Social Security disability insurance is you have to have worked, because you have to have work credits that you pay into the system. So you have to pay Social Security taxes. The number of years that you've done that changes based on your age. So the younger you are, the fewer years of taxes you've had to have paid. So let's say you're only 19 years old and you worked for about 3 years between the ages of 16 and 19. You should have enough credits to apply for disability at that point. But let's say you're 25 years old and you haven't worked since you were 18 because you went to college and you didn't work in college. You're not going to have credits anymore. So you're not going to be eligible for disability anymore. And so when you're looking at the SSDI program, you have to have a work history where you paid into Social Security. This is an important distinction because there are some jobs that don't pay into Social Security, like teaching jobs. In Ohio, in the state of Ohio, you pay into OPERS, which is the Ohio Public Employment Retirement System. It seems like I'm pretty up on Ohio, but I went to law school there, so I know that randomly. And then if you work certain state jobs, I know in the state of California, if you work for a California state job, you pay into their retirement program, but you also pay into Medicare. So you can get both, but you'd have to apply for private disability. So again, for SSDI, you have to make sure you're working and paying taxes into Social Security, and you have to have a disabling condition. It doesn't have to be a disabling condition that's on their medical listings, because you can meet or equal a listing. there are so many different diseases and diagnoses in the world. Like Social Security can't cover all of them. It's nice that Huntington's disease has a specific listing. It makes it way clearer to understand what Social Security is looking for. But just because you may not have a disease that's listed in their listings doesn't mean you can't be found disabled.
So that's a great point. So let's say even if you're a younger person, maybe you're in your 20s or you're starting your career, it's good to sort of figure out, hey, am I in a job where I'm paying into the Social Security disability system, or is there a separate fund that my employer is paying into, whether it's organized through the state or organized through a union, whatever that is. It's always good to kind of research and figure that out.
Yeah, well, because I know I actually did pay into OPERS a little bit when I was in law school, and I know I didn't read the fine print. I was a really bad law student. I didn't read the fine print. I had no idea what I was paying into, and it really wasn't until I started my job as a disability attorney that I really understood the ramification and implications of what that meant after the fact. Like, if you know you're going to pay into that system, if you're going to be a teacher and you teach for 10, 15 years, then you're okay. Then it's not a big deal. But if you only pay into that system for maybe a year or two and then something happens and you can't work anymore, you probably haven't paid in long enough to get their disability credits, and you haven't paid into Social Security, so you can't get Social Security's disability credits either, unless you apply for that other program, supplemental security income. We're not getting into that right now.
No, that's a whole other episode. But that, I think, is something that goes to another point, which I know we've talked a bit about, which is preparedness. And for folks in the HD community in particular, whether you're at risk, whether you've tested positive, being prepared for what might come in the future. So thinking about if you're in your 20s, if you're in your 30s, or if you're 19, you're starting a career, why you should be thinking about these kinds of things, why you should be figuring out what are the types of, am I at a job where I'm paying into the system? What would I need if something happened to me to be able to pull out of the system, to be able to pull out from either from SSDI or from the sort of private insurance that might be the private fund that's being utilized by your work or your union or your state. That's a really great thing to think about. Are there other things that you think, if you're if say I'm a young person in the community, I'm at risk and I'm in my career, what should I be thinking about? Why is disability something for you to think about right now?
So this is a topic I'm really passionate about, being the preparedness aspect of it, because I have ended up working with so many families who weren't prepared, and it got them into so much trouble. One thing I like to say about the HD community is that they somehow managed to fall into all of the gaps in our system. And that's why, as a young person, you have to start thinking about this in advance. No one wants to have to think about this stuff when they're 22 years old. No one wants to have to deal with the emotional burden of this, but I promise you, if you think about it when you're young and you're prepared, you're going to be so much better off. And so when I say prepared, it's things thinking about, like, are you going to need long-term care insurance? And that's the kind of insurance that's going to pay for nursing home care in the future. This is important because with SSDI, you get Medicare. Medicare does not cover nursing home care. Only Medicaid does. Not everyone will get on Medicaid if you're on SSDI. So the national average for benefits right now is $1,234 per month. If you make that, you would probably also be Medicaid eligible depending on your state. But let's say you you were an engineer and you worked for 20 years, 15, 20 years, you could easily be eligible to get $2,500 a month in disability benefits. And if that's the case, while that's a nice sum of money, you're not going to be Medicaid eligible ever. So if you don't have the long-term care insurance, you're going to have to pay for that out of pocket, or hope that one of your family members can take care of you. And that gets really tricky and difficult with HD. You also want to make sure that you have access to disability insurance, because you want to have that added protection. And the farther in advance you plan, the better able you are to prepare, because when you're looking at different benefits through your employer, a lot of employers do offer long-term and short-term disability benefits. I don't care if you're going to be disabled or not. Everyone should pay into those benefit programs if you have that option, because you cannot predict the future. You do not know what's going to happen. Also, they provide a really nice intermediary from when you have to stop working to hopefully when your Social Security disability will start. I don't want anyone to have to go 2 years without income because they didn't sign up for the benefits with their employer. Because one of the misconceptions is that if you have HD, and I just talked about this in my recent webinar about disability myths, that it can be really easy and really quick to get Social Security disability insurance. That is not true. You should never assume that it's going to be quick or easy. You should be prepared and do your due diligence. The national average is 6 months, but it could take years. And I don't want anyone to go without income because they didn't prepare. And so, young, it's important to think about disability and like employer-provided disability insurance, long-term care insurance, which unfortunately in most cases you have to get before you get the gene test, because now insurance companies ask questions that would preclude you if you actually have the HD gene. And just kind of looking at what the Social Security disability process looks like. Not saying you have to become an expert, you just need to make yourself aware so you're protected and your family protected.
So is this something, for example, let's say someone watches this and they're thinking, you know, they're 25 and they're in their career and they're at risk, they haven't tested yet. Would it be okay for them to reach out to you and say, hey, Allison, like I'm trying to get ready, I'm trying to get prepared, I feel a little bit overwhelmed. What are things I need to get my ducks in a row at this point in time?
So some of the things that really matter are your age and whether or not you're symptomatic. If you're 25, you're feeling great, you're not symptomatic yet, and maybe in your family, you know, it's no guarantee, but you know, people have become symptomatic closer to 40, then that means that you definitely have time. But I would make sure that you have long-term and short-term disability through your provider and that you can continue to get that through your employment. It's really important to make sure you get health insurance through your provider as long as you can, because that's another thing that's really important. Yes, unfortunately at this time, there is no cure for HD. There are not a lot of treatments that are going to stop the progression of the disease, but getting regular care can still slow the progression if you're getting the right treatment for the right symptoms. Yeah. Like as long as you're treating symptoms, like if you have behavioral symptoms and you get on the right medication or you're managing them correctly, that can still delay everything else because you're staying on top of it. So
yeah,
health insurance is important.
It's about symptom management, right, at that point. And it's avoiding decompensation, which means sort of avoiding big major crisis events that can throw your whole kind of system out of whack. You know, I think what a lot of folks in the community might see is, you know, if you have a major behavioral episode or a major health episode or a psychiatric episode, things kind of can snowball from there because you go through a sort of a decompensating period. And that's when you might see other symptoms kind of popping up or becoming worse. And we don't necessarily know what the exact correlation there is, but we do know that stability is best, right? And maintaining as much stability as you can, both from a healthcare management and mental health care management standpoint, is incredibly important. And kind of the gold standard of what we can do for right now until we find a cure and a disease-modifying treatment for HD. So another thing I know preparedness is such a big deal and big for the community. What if I'm working with my parent? So let's say it's time for my parent can't work anymore and it's time for them to apply for Social Security disability insurance. What can a young person or a family member do to help be supportive there?
So when it comes to a Social Security disability application, I always highly recommend that you always get assistance. And so it's really great if you're helping your parent. And the reason I say that is because the person with HD, they're in it. They live it every day. So they can't always recognize their symptoms and limitations, and they may need more help than they'll let on to or they may be aware of. Yeah. And so what a younger person can do is they can actually like physically help their parent complete the application, or you can write a letter and submit it to Social Security. One thing that's not well known is any individual, like friends or families, can actually as an appointed representative for someone with HD. It doesn't have to be an attorney. Not a lot of attorneys that specialize in HD representation just because it's a rare disease and there are not as many people who live in a specific area. Like there's not as high a demand. And so for some families, like you know the ins and outs of HD, you know the ins and outs of your loved one, I would recommend then, like, you can submit your own disability application because you understand the HD and the person's symptoms and limitations better than an attorney might. And that's why, like, that's where family and friend help can come into play. It's important to talk to your parents about getting the right legal documentation in place, like a power of attorney document or a medical power of attorney document, because there might come a day where you need that information but your parent is cognitively too far gone to make that decision, but not far enough gone where you have any rights in the situation, because there is definitely legal limbo. It's really hard to get guardianship, full legal guardianship. You actually have to file in state court, and you have to prove that the person is incapacitated, which is really a really high burden on families and can be really difficult to do.
Yeah.
And a power of attorney just means you have someone in place. If you can't make decisions, it doesn't mean they automatically have the power to make decisions for you in that moment.
Yeah, and the other thing there have been so many families who have contacted the helpline or have gotten in touch with us who are at that point. And if you're also dealing with a person who's at that point in their disease progression where they aren't quite capable anymore, they don't have the ability to make those decisions for themselves, and they need guardianship, going to court on top of all of that, which can also be acrimonious, which can throw into out of whack caregiving routines and all kinds of things, can be a really, really tough burden on families. So it sounds like, again, thinking about that preparedness, always thinking ahead, if you can, getting these documents ahead of time. None of these are going to be necessarily super fun conversations. Let's talk about power of attorney. It's going to be tough. And sometimes people might be kind of avoidant of these conversations because it implicates, I'm going to be sick, or it sort of brings into the forefront, I'm going to get to a point where I can't make these decisions by myself, where I'm not going to be independent anymore, where I'm going to need help. And a lot of parents, friends, family members, aunts, uncles, you just don't want to think about that. That's a tough thing to think about, but it's important because it gives you one peace of mind and a plan. So that when you get to a crisis point, when you get to a point where it's sort of the rubber is meeting the road here, you don't then have to scramble to put things in place. It's already there for you. It's kind of pushing through and recognizing, all right, we have to do this. As uncomfortable as you might be, as much as you might want to avoid this topic, push through, get some of these things in place because it will be beneficial in the long term.
Yeah, nobody calls me because they want to. They're not like, oh my God, Allison, you're great. They're like, oh no, we have these difficult conversations we need to have.
Yeah.
I like to joke, I'm like the evil queen's magic mirror. I tell you the truth, whether you want to hear it or not.
Mm-hmm.
And I just want people to be in a situation where the truth I tell you is just like, hey, you're taking all the right steps, you're doing all the right things, here's all the planning you need to do, instead of having the conversation, you waited too, or you did something wrong, or now trapped in the middle, and unfortunately our system always out of it.
Yeah, that's the other unfortunate thing is there's not really a lot of room for error in the social safety net system that we've set up. We've created it in such a way where we've been very, very careful about any sort of types of fraud or making sure that only folks who need it can access it. But then we've also made it so difficult sometimes for the folks who need it to access it that it can be prohibitive, which can feel like it defeats the purpose and can feel really frustrating for families. I think that's also an important thing to say is this can be a frustrating process. This can be a difficult process. This can be an emotionally taxing process. We know, it's not you, it's this, it's the system and how it's been set up, really.
Yeah, I actually say that all the time. I'm like, it's not you. It's not a reflection of your case, especially if you're dealing with a denial. If you get denied, so many people get denied, and there's so many reasons that play into that. But for the most part, it's not you. It's not your case. A lot of times it's Social Security. It's the way the system has been set up. It's someone who looked at it, didn't necessarily understand Huntington's disease. There's just, or other things got misplaced along the way, because your disability case is actually seen by multiple different people. Multiple people touch it. There is definitely room for human error. If everything worked in a perfect system, HD families would probably get approved a lot faster and a lot more often. But we don't live in a perfect system. That being said, there's still hope, and it's okay. There are people and resources that you can contact, like myself, who can help you through this process. It can seem very daunting, and it can seem almost impossible at times, but it's not true. Especially with SSDI for HD families, it is 100% worth the fight. You are worth fighting for.
It's a good point that you bring up as well in terms of people and resources. So something that I know we've talked a little bit about within sort of our mission team is this idea of getting your sort of network together. So, and creating kind of a continuity of care for yourself and a care team, so that when you get to this point, you have folks who are experts in HD or have been treating HD patients who can write documentation for you that's going to be very compelling. So who are folks that someone might want to be working with to set their team in place so that they're, again, prepared for when you get to this point?
Well, so number one, you need a really awesome medical team. And so on your medical team, you should have a neurologist, and the neurologist should have supporting staff. Like you might need physical therapy, occupational therapy, speech therapy. You might see a psychiatrist. All of those doctors are super important. A primary care physician can also be super important, and they could offer a lot of good assistance. Definitely helps to be seen at a center of excellence if you can, because they do specialize in HD care and they do have a better understanding of HD. And a lot of times the clinics might also have a better understanding of the disability process because they have social workers. Social workers should also be part of your care team, because a lot of times it's the social workers who do a lot of the grunt work to make sure your disability application gets done. They do a lot of the grunt work to make you and your family have the resources they need. They're the people you go for questions. So if you have access to a social worker in your community, whether it's a center of excellence or you have a chapter social worker, you definitely need to utilize them. And I always strongly recommend having a support network within your family. And it doesn't have to be a huge family of 10 people, even if it's just one person, if it's your brother or your mom or your son, like you just need one really good person who can help you through this. It's nice the more people you have, but like having at least one. So strong medical staff, getting as much medical care as you can, having a social in your corner, and then having a friend or family member who can help you through this.
Yeah, and having a social support and a medical support team just generally are going to be really important in going through the HD sort of process, going through this disease. Whether or not you end up having to apply for Social Security disability insurance or being eligible for SSDI, those are just things that are great to have regardless, but it will make this process simpler and a little bit more seamless for you if you've also got that when it comes to SSDI. Trying to think of another thing that I was thinking of is for someone who's going through this, who's just been denied, what's next? I think a lot of people might see a denial letter and think, well, that's the end. That's it for me. I guess I don't get SSDI. I guess I'm not eligible. What happens if you get a denial?
So you're going to get the attorney answer right now, and you might get maybe a little bit of the human answer, but because I have seen so many denial letters, there's actually multiple reasons why you could get denied. So a lot of times when people call me, they're like, Allison, I've been denied. What do I do next? And my question is, well, why were you denied? A lot of times they say, I don't know. The reason for your denial is really, really important. Most of the time it's because they have a medical denial, which means Social Security found that you could do other work. They didn't think your condition was severe enough for whatever reason. A lot of factors playing into that. And so if you have a medical denial, you want to appeal it. Like you always want to appeal that decision. There are most of the time, like most individuals with HD are symptomatic and it's worth appealing. There are some circumstances where some people apply too soon. That's harder. As an attorney, I would never tell you you're not symptomatic enough. That's honestly a conversation your doctor or your medical team should be having with you. Like that gets into questionable territory, but I would appeal your decision if that is what you wanted to do. Really where it gets tricky is if you have a technical denial, and most people don't know what technical denials are. So that's if you're working too much, which is pretty clear cut. If you're working too much, you just need to cut back your hours and then start over. You can't really appeal the fact that you're working too much. And then the other technical denial is if you don't have enough work credits. Sometimes you can fix that. You could go back to work, or you could work more and earn your work credits, or sometimes Social Security just hasn't processed taxes. That's how they establish your work credits, through your taxes. So it's possible, since like right now, it's March of 2020. I haven't filed my 2019 taxes yet. Yes, I know I'm a slacker. But because I haven't filed my 2019 taxes, let's say my work credits are going from year to year. And so right now it looks like they expired in December of 2019. Well, I haven't filed my taxes. So I do actually have work credits. Social Security just can't see them yet because I haven't filed my taxes.
Okay.
That's definitely a technical thing. If you have that issue, please call me. Yeah. But like for most people, if you're denied, it's one of those situations where it's definitely a punch in the gut. So it's kind of like go through those stages of grief. but like go through them maybe in like 2 days and then call me and be like, we got this. Okay, so this is what we're going to do. We have a game plan. We can move forward. It's just, if you can make a game plan for yourself and just think of Social Security like they don't know you as a person. They judged you based on a piece of paper. Maybe the piece of paper wasn't accurate enough. And so what can you do better to make your application stronger? Because you do have to take responsibility for your application, because the way the law is written, the way Social Security analyzes a claim is you, the person submitting the disability claim, it is your responsibility to show you're disabled.
Yeah, it's not necessarily Social Security's their responsibility to sort of divine from extraneous information or information that's not included within your application. Yeah, I think that's a really great point to think about. One, to that, you might just not have enough work credits because your taxes haven't gone through yet, as someone else who is also behind on filing their taxes. But this year we all have an extension, so congratulations to all us Slackers. Extraordinary circumstances, but that's a really good thing to think about. So it seems like if you get a denial, the first step is just sit back and take a breath. Start there, then go through, read the denial letter, find out the reasoning, and then start to work a plan from there.
Well, yeah, and it is really important to actually read through the entire denial letter. Every state works a little differently. So some states will attach a document that says, this is why we found you disabled, and it will include all the medical evidence they received. You need to look through that to make sure they actually got all of the relevant medical evidence, because sometimes they don't. And it's not for lack of trying. Social Security really has to request the records, but requesting the records and receiving the records are two different things. Stuff happens. Sometimes they send it to the wrong place. Like if you go to the HD Center of Excellence Clinic at Columbia, because it's a partnership between Columbia and New York Psychiatric Institute. If they request records from the New York Psychiatric Institute, you're not getting anything. So I always tell, just use the social worker, just send everything to the social worker, and it'll get through. I still haven't figured out where to request those records either, and I've been doing this for years, so sometimes it's just complicated. But sometimes medical record departments are backlogged. So in light of COVID, the COVID circumstances, like medical record departments could be backlogged. I'm not really sure how hospitals are operating right now, but like if doctors need to get medical histories for other patients, they're definitely going to take precedence over a disability application. And so maybe things just get lost or things just take too much time, and Social Security has to make a decision whether they get the records or not.
That's actually a really great point. Knowing that we're doing this because we're in the midst of a global health crisis, is there anything that folks would need to know right now, about Social Security disability insurance? Anything that's changed drastically for this particular moment in time?
So Social Security did release last week that there will be no in-person appointments. Social Security is still open and operating, but you have to use online services or you have to call over the phone. Okay. Disability applications are still being taken, they're still pending, and your disability benefits have not changed. You are still going to receive your disability benefits. There is a fraud warning out right now that people have sent out letters saying your benefits will be stopped. Do not listen to those warnings. If you get that letter, ignore it, burn it, call Social Security and let them know that you got it, because your benefits are okay. The one place where it gets tricky now is if you actually have an administrative law judge hearing pending for your disability. Hearing offices are operating on an office by office basis. Some of them are doing phone hearings. Some of them have postponed everything altogether. And so you will have to reach out to your hearing office directly to find out what's going on in the case.
Okay. And again, this would be a really nice time to have a friend, a support person, a family member who's helping you out with this, right? Who can help you through that process. If, the idea of calling up your local, the administrative law office, if that feels sort of too complex or too confusing, or it is too complex and too confusing, having someone to help guide you through that could be very helpful.
I admit there were days I wish I had someone to help me through it, because I just didn't want to deal with them sometimes. It's okay. It happens. It happens to everyone. And if you have any trouble finding your local hearing office, let me know. Their office finding tool is a little confusing to use, but that information is online.
Okay. And the other big thing for folks to remember is that you're an excellent resource here. Between, the local social worker that you're working with, whether it's at a center of excellence or through your chapter affiliate, or your regional social worker, those folks yourself are really great resources to help guide you through this process, right? Because you don't have to go it alone. You don't have to do it all yourself. If you need help, reach out. It's really important to be able to ask for that kind of assistance.
The one thing I will caution everyone about is that talking to your support group is great, using Facebook is great, but you have to remember your case is unique. Everyone's case is different, so what may have worked in someone else's case is not going to work in your case.
Yeah.
There's a lot of misinformation, especially about disability on the internet. So if you want to guarantee you get correct information, look at Social Security. That can be a little bit complicated, but Social Security has a number of resources that are helpful. Contact your social worker or ask me. I always tell everyone to ask me. That's why I'm here.
Yeah, don't ask Google first. Don't do it. Definitely don't ask Facebook first. Yeah, it's not a system that's set up for where there's one right answer for everything. It is important to remember that it's a case-by-case basis. Don't, think that it happened one way for your friend in support group or for your uncle or for someone else, that it's going to be the same for you. All right. Well, I think that it seems like sort of the big takeaway here is be prepared, which I feel like might also be sort of like a Girl Scout motto, but it seems to be extremely important for folks in the HD community, especially when it comes to disability. So that's a huge takeaway here. If you're watching and you're young, start thinking about these kinds of things. Ask questions, dig into some of that information about disability, about whether you're paying into SSDI or whether you're paying into a private option or an option through a union. Think about get long-term care insurance, especially if you haven't tested yet. Set up your own private short-term or long-term disability plans, especially if they offer them through your employer, because they tend to be fairly, decently generous if you can. These are all really excellent points. I think it's for young people, especially who might not want to be thinking about them getting, themselves getting sick because that's very anxiety producing. It's also important to give yourself some of the safety net of being prepared. Well, Allison, I just want to thank you so much for jumping on and being our first participant in our virtual Here's the Deal. Again, thank you so much. And for folks who want to reach out, it's Allison Bartlett, so Bartlett at HDSA.org. She is an incredible resource, and we feel so lucky to have her from Caring Voice Coalition. So their loss was definitely our gain. Thank you again so much, Allison.
Thank you so much for having me. This has been great. You guys are too nice to me, but I'm happy to help. I want to share the way too much information in my brain with families to help you through this process, because this is not fun or easy. I just want to make your lives a little bit better, a little bit easier.
That's what we're here for. And that's the deal with Social Security disability insurance.